Good morning, everyone. My name is Charlene Moeller, and I'm with Neath Brookins, we're your broker. And this morning I'm going to talk to you about your health care plan for April 1st. Currently you have Anthem as your plan, and we are going to be switching to United Healthcare. So you will be getting new ID cards from United Healthcare. In your packet of information on the left-hand side, you'll see a benefit summary. If you'll take all that information out of there, I want to go over both of your benefit options. We have the same options that we had currently with Anthem. One is called a PPO plan, and the other is called a high deductible health savings account plan. The first one you'll see in your packet there is the benefit summary, and you'll see down there in the middle of the section under network benefits, the individual deductible is $3,000 per year and $9,000 for family. The out-of-network benefits, you would pay $6,000 for individual deductible and $18,000 per year for family. It would behoove you to stay in the network. United Healthcare has a very large network, so you'll want to check with your doctor's office to make sure that they are taking United Healthcare, and you'll want to talk to them about the Choice Plus plan. That's what your plan is called. I'm just going to go over the network benefits because, as you'll see in this packet of information, if you go out of network, it's going to cost you more money. Plus, your doctor can do what we call balance billing, which is whatever the insurance company doesn't cover or allow, you would be responsible for, just like it is in Anthem. In the middle of the page is an out-of-pocket amount of $3,000 for an individual and $9,000 for family. Once this out-of-pocket is met, for instance, if you have a catastrophic condition, such as maybe a heart condition, or you've been to an accident, auto accident, something like that, the maximum you pay out of your pocket on an individual coverage is $3,000 per year for your medical and $9,000 for the family. And then once that is met for that calendar year, it goes into 100% for the remainder of the year, except for the co-payments that are applied throughout here. But if you're hospitalized, it would pay at 100% for the remainder of the year once that out-of-pocket maximum is met. I also want to mention to you that if you currently have Anthem, we will be rolling your deductible whenever you've gotten that for this year over into this new plan for April 1. So if you have met, say, $100 or $150 of your deductible with Anthem, we'll be getting a report for that, and we will give you that credit. If you'll look on the second page, under physician's benefit, you have a $30 copayment. So if you go to the doctor and you have something wrong with you, you make your $30 copayment when you leave, and then they file the claim with United Healthcare, and United Healthcare will pick up the balance of anything that's allowable. So in other words, if they charge $100, you pay your $30 copayment. Once it gets to the insurance company, if they cut that back to, say, $80 or $70, you're not responsible for anything that they do not allow, as long as it's a network doctor. If you see a specialist, it's a $60 copayment. Specialists will usually cost more, and those are people like your heart specialist, rheumatologist, anybody that's considered a specialist that's non-family doctors. The next section is called preventative care, and we will allow one routine exam per year, along with any x-rays or preventative tests. Preventative tests are covered at 100% and not subject to your deductible. Under the Health Care Reform Act, we have to cover preventative care at least once a year at 100%. Now, the thing to remind yourself about when you make your appointment for your doctor for your preventative care is that you want to make sure you stress to them, I'm coming for preventative examination. So if you have something wrong with you and you've been going to this doctor, say you have high blood pressure, you don't want that to be a high blood pressure visit, because that will be applicable to your $30 copayment and your deductible. So when you're going to the doctor, it's strictly preventative, and make sure that when you leave, they are going to code it as preventative, so it doesn't become a medical claim.
Is that for, like, if I get family, is that for each person in my family will have one of those, or just one per plan?
No, every family member has one per year. The next section is urgent care and emergency health. Under the urgent care, you have a $100 copayment if you're seen at the urgent care center. And if you have to go to the emergency room, there's a $250 copayment. So you want to only use the emergency room whenever it's necessary. If you're sick over the weekend and can't get a hold of your doctor, then you would want to use the urgent care, unless they send you to the emergency room. The next page talks about hospital inpatient stay. It's 100% coverage after you've met your deductible. So after you've met your $3,000 for the individual or $9,000 for the family, then inpatient is covered at 100%. Air ambulance and ground ambulance is the same. Dental services, there's a $3,000 max for an individual and $900 per tooth, and this is only for accidental injuries to your teeth. This is not dental coverage. So if you're in an auto accident, you get your teeth knocked out because you hit the steering wheel, you can get that covered under this plan because it's due to an accident. Okay. Durable medical equipment, there's a $2,500 per year limit for any single type of durable equipment, so like hospital beds, wheelchairs, those kinds of things. And after your deductible is met, then it'll pay at 100%. Hearing aids are also covered in this plan. On page 5, you'll flip over. Home health care, which will be someone coming to your home to take care of you, and rehabilitation services is paid at 100% after your deductible, and there are 60 visits a year allowed. Hospice is also covered at 100% after your deductible is met. Lab and x-rays, outpatient testing, deductible does not apply. So what that means is if you go to the doctor's office for a medical reason and they send you to a lab, be sure you go to an in-network lab, and then that will be paid at 100%. And the only thing you'll have to pay for your doctor's office and the lab is your $30 or $60 copayment. Any kind of major diagnostic labs, such as your MRIs or PET scans, those are at 100% after your deductible. Okay, the rest of it, I'm just going to kind of flip over here to the next page and talk about rehabilitation, outpatient therapy, which includes chiropractic. There's a $30 office visit copayment each time you go for any kind of rehabilitation services. There's 20 visits per year allowed, except for cochlear implant and oral surgery. The therapy is at 30 visits per year. Your scopes, which is like your colonoscopy, your sigmoidoscopy, or endoscopy, is 100% after your deductible is met. If you go into the doctor's office and they do a preventative colonoscopy on you, most people 50 and older will get one with their preventative care services. That's paid at 100% of the preventative, provided that they don't find anything wrong. Your skilled nursing facility is at 60 days per year, and after your deductible is paid at 100%. Outpatient surgery is 100% after deductible. And any kind of therapeutic treatment, such as dialysis, oncology, those kinds of things, chemotherapy, is 100% after your deductible is met as well. You also, on the next page, have a vision exam. You're allowed one exam every 2 years under this plan. So if you haven't been to the eye doctor in the last year or so, go to the eye doctor that's in the network, and it will be paid after your $30 copayment by the insurance company at 100%. Any other questions about the medical plan?
Yeah, is there anything in here about the medication?
I'll get to that in just a second. Okay, you want to flip back another page in your benefit summary, and you will find your prescription drug plan. Under this plan, if you go to the retail pharmacy, which is like Kroger's, Walmart, those kinds of places, and get a 31-day supply, anything that falls into Tier 1, which is usually your cheaper generic drug, that's a $10 copayment. Tier 2 is $35, and Tier 3 is $70. Now, if you have to have what they call specialty drugs, which is usually the more expensive drugs out there, you will have a different copayment for a specialty drug. If it's under Tier 1, it's still $10 for your copayment, but Tier 2 and Tier 3 is either $100 or $300 for your specialty drug. There's an individual out-of-pocket of $3,500, so once your copayments all add up to the $3,500, then your out-of-pocket maximum has been met for the year. And then they would pick up and pay the rest of those drugs for that year under your plan. And for the family, it's $10,500. You still have mail order with this, and in your packet there is a mail order. It's with Medco. So there's a form in there. If you've been getting mail ordered with Anthem, then you'll have to complete this order form that's in your packet, get a new prescription for your drugs, and mail it into Medco. You will save a little bit of money on a 90-day supply. Tier 1 is $25, so it's like 2.5 months supply, or 2.5 months of cost for 3-month supply. Tier 2 is $87.50, and Tier 3 is $175. The specialty drugs, you can't get those through mail order. That's just not covered, but that doesn't mean it's not covered. You just can't get the specialty drugs through mail order. A lot of the specialty drugs are your narcotic drugs market. People that use specialty drugs usually are very sick, some kind of heart condition or something very serious. So you have to pick those up at the drugstore. So that's why they're not covered under the mail order. Any questions about your drug? Okay. The next plan you'll see in your packet is called a high deductible health care plan or an HSA plan. Is anyone currently in the Anthem HSA plan? No? Okay. You have an opportunity this year to elect the HSA plan. So I'll go over how that works. With this plan, like we said, it's a high deductible health care plan. So instead of having a $3,000 deductible under the PPO plan, you only have $2,500 to meet. But under this plan, you have no co-payment, no $30, no, doctor's office visit. Everything you pay for is out of pocket until that $2,500 for an individual or $5,000 for the family is met. So how you're going to get to your annual out of pocket of $4,500 or $9,000 is through anything that you see that does have a co-payment. So on page 2, you'll notice that, well, I apologize, there is a $30 co-payment with this plan. Most HSAs do not have a co-payment. So for every co-payment that you make after your deductible is satisfied, that goes towards your out-of-pocket, which is $4,500 for a single and $9,000 for family.